Each year at the UK Markey Cancer Centre, more than 450 thyroid cancer patients are provided specialized care tailored to their needs. Our thyroid cancer program includes doctors, nurses, and researchers from multiple specialties, all working together to advance cancer care in Kentucky. We're thrilled to welcome Dr. Omar El-Kawagi to the UK healthcare team. Dr. El-Kawagi is an endocrinologist and thyroid cancer expert. He recently appeared on Fox 56 to talk about the thyroid's essential role in keeping our bodies functioning at their best. It's an important conversation, and we're proud to have Dr. El-Kawagi bringing his expertise to our community.
Give us an overview of what thyroid cancer is and what sort of symptoms people may experience.
Yeah, well, thank you for having me. So I think to be able to answer that question, I have to tell you a little bit about what the thyroid is. That's a very common thing that I get asked. So the thyroid is a butterfly-shaped gland that sits in the base of the neck. That's why I wear my thyroid pin.
I was going to say similar to the pin.
Similar to the pin. And its job is to make something called thyroid hormone. Thyroid hormone makes a whole lot of functions in our body. It helps control our heart rate, our metabolism, weight, blood pressure. So it's a pretty critical little organ. Thyroid cancer is basically a tumor of thyroid cells. So those are thyroid cells that have multiplied at a fast rate, creating a tumor that can occasionally spread outside of the thyroid and into other tissues. Most thyroid cancers are actually start out as what's called a thyroid nodule. A thyroid nodule is a mass on the thyroid gland. And thyroid nodules are usually detected what we call incidentally, meaning that a lot of times people don't have symptoms, but rather they go in to see their provider for another reason. Say, for example, they had an X-ray or some sort of CAT scan, and it found this incidental thyroid nodule. And so most people don't really have a lot of symptoms. But the reason that I bring this up is it's pretty critical that if you or your provider do find one of these nodules on, say, an imaging test or even by an examination, a physical examination, it's pretty critical to discuss with your provider, could this be a thyroid cancer or not? The good news is the vast majority of these thyroid nodules are not cancer. They're benign.